Dr. Lindsey here. When we finish a case, we go over the instructions on how to take care of your hair transplant in detail. Additionally, I've got lots of videos on YouTube that go over this. And the bottom line is we tell people don't touch the hair, the recipient site or the donor site, the first night, because the hairs are just barely in there. We make a very small slit and insert the grafts into the slit, and they're just held in by friction for the first 12 to 24 hours. After 24 hours, there's a pretty good fibrinous knit holding the grafts in place, and it becomes much more difficult to disturb the grafts. But immediately after the surgery, you take your hand up and you touch the recipient area, and you'll get a handful of hair grafts. So we go over this in detail. Nevertheless, the fellow that I'm going to show you left the office, decided not to take his pain medicine, admitted to drinking alcohol, probably in excess, and then decided to put a wet washcloth on his recipient area a few hours after his case. And I saw him the next day to check him before he traveled back to his home area, and it looked as if about 70% of the grafts in his crown had been removed, and probably 400 grafts up in the front have been removed. And there's really nothing you can do at this point. The horse is out of the barn. Fortunately for this guy, he's got really thick, bushy, wiry hair. I think his crown will probably be okay. The front, we'll see. Next year, if he's thin, we'll have to address it. But the price of the repair case is going to be he's going to have his wife stay with him to make sure that he does not disrupt the grafts and that he follows instructions for the first week. So use this as an example of what not to do after the surgery. Follow your doctor's orders, and unless told specifically, don't touch the recipient area the first night. Thank you.